I'm going to be doing a head-to-toe assessment. So you come in and you introduce yourself. Hi, my name is Ladeep. I'm going to be your nurse today. So can I have you tell me your name and date of birth, please?
Manny, November 1st, 96.
Okay, and then so the next thing I'm going to do is I'm going to provide privacy. I'm going to make sure that there's no obstructions on the bottom of the floor, make sure that there's nothing going on. Check to make sure my oxygen, my suction is working in case I need it. And I'm going to raise the bed up. I'm going to go wash my hands, get gloves, and then I'm going to come back and do your head to toe, okay? So make sure I don't get corona, don't get a tan. So the next thing I'm going to do is I'm going to go from your head and go down to your toe. I'm going to be inspecting, palpating, and I'm going to be going through this whole procedure, okay? So can you take off your glasses for me first, please? All right, thank you. So I'm going to go from his scalp, go down here, make sure any hair loss or anything of that sort, any scars, lesions, edema, anything like that, any bed sores. I'm going to go down to his ears. I'm going to check and inspect his ears, palpate the lobes. I'm going to have him turn his head this way, all right? And then I'm going to take my pen light, make sure about any obstructions with his earwax, and I'm going to have him turn his head this way. Check this ear. And the next thing I'm going to do is I'm going to check his hearing. If you could hear these hear what I say, can you please repeat it? 1, 2, 3. 1, 2, 3. All right. And this side. 4, 5, 6.
654.
Okay, so in real life, I wouldn't be leaning over the patient like that. I'd be going to the other side, but since we don't have an actual bed, this is what we're doing. So the next thing I'm going to do is go down from his ears. I'm going to go down and check his eyes. So with his eyes, I'm going to make sure that his conjunctiva and everything else is okay. Check to see if there's any drainage, any scarring, any redness, things of that sort. Next thing I'm going to do is I'm going to check the 6 points. So if you could just follow this with just your eyes, with mouse. Alright, his eyes are parallel. And the next thing I'm going to do is I'm going to check for pupil dilation. So if I could have you close your eyes for me for 5 seconds. Alright. Go ahead and open them. Alright, so he does have his 6 cardinal fields of vision are intact, and his eyes are parallel. The next thing I'm going to do is I'm going to go down to his nose. If I could have you move your arms up and close one nostril at a time, breathe in and out. Through your nose only, please. Thank you. Alright. So next thing I'm going to do is I'm going to take my pen light, check, see if there's any septum deviation, check his nostrils, make sure there's no obstructions or anything of that sort. Alright, everything's good to go there. Next thing I'm going to do is I'm going to have him open his mouth for me. Can I have you stick your tongue out? Say ah. Alright. And the next thing I'm going to do is I'm going to check his dentition as well. See if there's anything going on, any cavities, any cracks, any fake teeth, anything like that, any infection. Next thing I'm going to do is I'm going to go down to his neck. There's a couple things that we need to check on his neck. First thing I need to do, see if his swallow reflex is intact. Go ahead and swallow for me. Alright, it is. Next thing I'm going to do is I'm going to check his carotid pulse one at a time. Alright, that's intact.
Thyroid.
That is as well. Next thing I'm going to do is I'm going to check his thyroid. So go in here, make sure it's of equal size. There's nothing going on there. Then last thing I would do is check to see if there's a carotid bruit. So with the bell of my stethoscope, let me put this on. Alright, so there's nothing going on with this carotid bruit. So from there, I'm going to go down from his neck. I'm going to go down to his chest area. So from here at his chest, what I'm going to do is I'm going to check his heart sounds. So there's 5 points there. I'm going to check his lung sounds as well, the 6. I'm going to check to see if there's anything going on with his chest, like any scarring, any lesions, any edema, any bruising. He has his glasses back, which is great. So first thing I'm going to do is listen to his heart sounds. So on this side, we're going to start from on his right side, and his second click of his face is going to be his aortic. Left second is his pulmonic. Left third is his herbs. Left fifth is his tricuspid. And left fifth mid-clavicular line here is his mitral. And here we can hear the S1, S2 node and their apical pulse, and we're going to be listening to that for a whole minute. In this case, his pulse is intact and his pulse is going to be 70. So the next thing I'm going to do after that, checking here, is I'm going to check his lung sounds, which is the 6 points. Breathe in and out for me, please. All right. And from there, going down from his chest, I'm going to go down to his stomach. So I'm going to ask him, when was the last time you had a BM, sir?
Today in the morning.
Okay. And do you know the consistency? Was it soft?
It's pretty solid.
Okay. Was it formed?
Formed, fully formed.
Okay. All right. So from there, I'm going to go. So with his abdomen, I'm going to inspect it, see if there's any hernias, any edema, anything like that. The next thing I would do is I would auscultate. Yeah, auscultate. So we're going to be listening from his right lower. I'm going to be making a big U. Going from his right lower quadrant up through his right upper. We'd be listening, to see if his bowel sounds are active or not. And they're active in all 4 quadrants. Next thing I would do is I would palpate. You have any tenderness there?
Mm-hmm.
Anything here? Anything here? All right. Next thing I would do is I would percuss, see if he has any tension, any rebound tenderness, any pain. All right.
All good.
All right. So the next thing I would do is I would go down to his peri area and I'd ask him when was the last time you voided, sir.
Today.
Okay. And do you know the color, consistency, odor?
Yellow, no odor, pretty good.
Okay. Was it clear?
It's pretty clear.
Okay. All right. So the next thing, are you continent or incontinent?
I am continent.
Okay. So we go down from his legs, or so from his peri area, I'll be going next to his arms. So with his arms, you palpate, make sure there's no bumps or any edema or anything of that sort. You also want to check radial pulses, make sure that they're both intact. They're strong and they're present. Next thing I would do, I would check cap refill on all 10 fingers, see if there's any disparities or any differences with his cap refill, see if there's any problems going down with the circulation. Next thing I would do is kind of have you lift your arms up. You're going to Six Flags. Can I have you move your wrists up and down? All right. Can I have you grip my hands as hard as you can? All right. So we're not holding hands. All right. So next thing I would do, all right, you're good to go, sir. You can put them down. All right. Next thing I would do is I would go down to his legs, check and inspect his legs, see if there's anything going on there. Then once I get down here, make sure there's no edema as well, any lesions, scarring, things of that nature. No DVTs. I'm gonna get here. I'm gonna check his dorsalis pedis pulse, make sure that's present. Check cap refill for all 10 fingernails and toes. See if there's any disparities with that as well. Next thing I'm gonna do is, can I have you pull against my hands? Can I have you push against my hands? Can I have you lift your legs up? Can I have you push down? Can I have you lift up? All right. And if you can you abduct your legs a little? All right. So his legs are fine, his range of motion's fine, everything's going good. So next thing I'm gonna do is I'm gonna have you remember these 3 words for me, okay? Light, bright, dynamite.
Light, bright, dynamite.
All right.
I knew that before.
Okay. So next thing I would do, since we're done with the front, is I'm gonna have him turn on the side. So I'm gonna be checking the posterior side of his body, making sure on all the bony prominences, some of them being like the sacrum, the elbows, the heels. Make sure there's no bed sores or anything of that sort. If you're inspecting, you're checking, palpating. Next thing I'm gonna do is I'm gonna list all 8 lung sounds on the back. Make sure his lungs are clear. Breathe in and out for me. So the patient is showing signs of crackles and wheezing.
Really?
Alright, so they're all clear. The next thing I'll do is check to see if he has any rebound tenderness. Any pain, sir?
Nope.
Any pain?
Nope.
Any pain?
No.
Same thing on this side. See if he has any pain.
Nope.
Alright. So, lastly, if you can, sir, can you turn back over? Alright, so now that I'm done with this procedure, I lower the bed, make sure that if he has any pain. Do you have any pain, sir?
Nope.
Do you need to go to the bathroom?
Nope.
Do you have everything within your proximity, like a call light, your glasses, your remote? Okay.
All good.
Alright. And then, are you positioned comfortably? Alright. So, can you repeat those 3 words for me that I told you to remember?
Light, bright dynamite.
Alright, so make sure his short-term memory is intact. And we're good to go. Wash our hands, and we're out of here.
Yay!